This is one of a series of 8 films featuring some of the early pioneers of quality improvement in the NHS, who share their personal stories and the practical wisdom gained from leading improvement when it was still a niche activity. The idea for the films was originally conceived during a conversation between Peter Wilcock and Helen Bevan about capturing the legacy of early improvement leaders, and it was given life by the publication of the National Framework for Action on Improvement and Leadership Development. I've been privileged to have met all of the leaders featured in this series of films early on in my own improvement career, and so I found it fascinating hearing their reflections as they look back on their experiences. We hope that their stories will make a powerful contribution not only to those of you implementing the new national framework, but to everyone aspiring to improve healthcare. You've been involved in quality improvement for over 25 years. Where did you first learn about quality improvement methods?
I first learnt about quality improvement methods because I was working in education in Sheffield and I decided to do an MBA. So I went to Sheffield Business School, and one of my teachers there was one of the very early pioneers of total quality management. So I just got the most fantastic TQM education in my mid-20s and was able to lead one of the first TQM projects in further education in Britain. So when I joined the NHS in the early 90s, I came equipped with a whole toolkit of quality improvement methods that most people hadn't heard of. So I was able to make a difference, I think, and do things in a different way and show people a different perspective at a time really when very, very few people were using or understood these methods in the NHS.
Okay, do you want to tell us a little bit about some of your early experiences using quality improvement in healthcare?
Yeah. So in 1993, I got a job at Leicester Royal Infirmary, and my boss was Peter Homer. And again, when I look back, actually having great bosses who really understand improvement, I think is very important at an early stage. And my job at Leicester Royal Infirmary was to be the outpatient improvement manager, and we set out a project called Project Excellence, and the goal was that within 3 years we'd have the best outpatient service in the whole of the NHS. So hospitals, healthcare, the NHS was a whole new world to me. But coming from outside, I came with a different set of eyes, a different lens for looking at things. And what I did was just sit around in outpatient clinics, observing for quite a few weeks. And then, particularly, I did some work with the team in ear, nose and throat. And what we did was that we held a process mapping workshop, and we mapped out the journey of a patient. And I can always remember vividly that I went to my first board meeting and I took with me this great long roll of wallpaper and very dramatically unravelled it on the board table. And what it basically showed was that a patient who had a pretty common set of symptoms, from when they got referred by their GP to when they got diagnosed in the ear, nose and throat clinic, it took 9 months. Wow. And in that 9 months, they got 12 minutes of clinical attention. The leaders around the table, looking horrified at this and saying, that's outrageous, we need to do something about this. And this was also the era in the early 1990s of business process reengineering. So I said to Peter Homer, we need to re-engineer the outpatients department. And Peter said to me, who's the greatest leader of re-engineering in the world? And I said, it's a guy called Michael Hammer, who's based in Cambridge, Massachusetts. So, amazing Peter with his vision. He sent me off, packed me off to Cambridge to go and learn business process re-engineering. And I came back and I said, Peter, we can't just re-engineer the outpatient department, we need to re-engineer the whole hospital. And he said, right, let's do it. And we embarked on, what was then the biggest ever improvement project in a single hospital in England.
From those early parts of your improvement journey at Leicester and then with the National Patient Access Team, what was your key learning?
One of the things that I really learned about quality improvement is where the magic comes from. And I used to think that the magic came from large-scale programmatic approaches. So, if we want to improve things for a group of patients, for people with cancer or people living with dementia, or people that need cataracts, because we've got quality improvement methods, because we've got this programmatic approach, then that's when the magic happens. And actually, what I've learned over time is that's not where the magic is. Actually, the magic happens when you get groups of people together that are really passionate about making a difference. That's the magic. And of course we need quality improvement methods. Of course we need to be programmatic. But actually, if we haven't got that magic where people are enabling change, are measuring because they really want to, rather than because they have to, then it isn't going to work and it isn't going to be sustained.
In your experiences early on in your improvement journey, I'm sure not everything went smoothly.
Yeah.
How have some of the things that didn't go quite so well influenced what you do now?
What I learned at a very early age when I chose to be an improvement leader is that, it's a pretty tough life. It's never going to be easy, because actually as a leader of quality improvement, you're somebody who is constantly challenging the status quo and, the way things are. And, we're part of a system that, is a hierarchy, holding people to account, people with positional authority. And actually I do a lot of informal coaching of quality improvement people in distress. And, the one thing that you see time and time again are people, colleagues who feel, I'm really working hard, I'm passionate, I'm making a difference, and yet I'm not able to influence, I haven't got a voice. And I think honestly, it's part of the choice that we have to make. That, if you choose to be an improvement leader, you're not going to get the voice in the hierarchy. You're not necessarily going to get the rewards in monetary terms or the glory, but actually, what you get in other ways from, making a difference, seeing the impact on people's lives, I think it's worth all the distress. One of the things I learned from working at Leicester Royal Infirmary was, however big and broad and ambitious the improvement programme, people don't judge you and evaluate you on how big and broad it is. Okay, they judge you on one or two things that are iconic and that they can connect with. So, when I look back to Leicester Royal Infirmary, we had over 100 quality improvement projects happening at the same time. We had scores of staff that were seconded from their normal jobs, working on this team. It was a massive undertaking. But people don't remember it at all for the 100 projects happening simultaneously. What people remember it for is just one or two iconic things. And one of these was that we set up an outpatient testing clinic. And again, back to my first love of outpatients. And, it's such a long time ago, but these were in the days when you actually took your photos in to be developed. And Kodak had a process whereby you could have your films developed in an hour. And that was our inspiration, the idea that you could, if you were a clinician in outpatients, you could send your patients to have all their tests done and complete with the results back in an hour. And that included having blood taken and getting the blood results, it included ECG, and it included X-rays. And so, instead of your patient having to come back or, 2 or 3 visits, you could just send them round to the outpatient testing centre and they'd be back in an hour with all their results. So, yeah, it was pretty revolutionary. And people remember us for that, not for the kind of breadth of what we do. When it comes to learning, I think we learn so much more when things go wrong compared to, when they work brilliantly. And I just think, the very nature of quality improvement, means that we've got to be learning all the time. We've got to be learning individually and, learning collectively. And, when I think back to some of the times that were painful for me, one of the times was when we set up the first ever collaborative programme in the National Health Service in England, which was called the Cancer Services Collaborative. And what happened with the Cancer Collaborative was that we had this 2-day big collaborative event in Dudley. I'll never forget it. And we had 200 people came to this event, of which about 150 were doctors, were surgeons and oncologists. And we got to like halfway through the first day, and a huge proportion of them had just switched off, because we didn't start from, what are we trying to do here? What are we trying to improve? The situation of people with cancer. What we did was we kind of sat them in a big room and we taught them method and approach, and it just didn't connect. I can remember one of the teachers coming up to me afterwards and said, why is it when I go into the bathroom, I keep finding your facilitators in there crying? Because it was so, we really built this thing up, and it was just so, it was so traumatic. And luckily, we were able to rescue it, and we just reflected and we learned. And very quickly we turned it around so that our focus was about, who are we trying to make things better for? What is our overall goal? Again, to link with that emotion and values and connection.
Having played a national role since the late 1990s, you've been part of several different organisations, working in an ever-changing landscape and system. How have you personally kept resilient? What's helped you with that?
I would say that the number one rule of being a health and care change agent is that you can't be a change agent on your own. However talented or creative or methodologically brilliant you are, you're in a system that kind of fights against you. And there's this process, I think it's called normalization, and it has these like long tentacles and expects you to behave in certain ways. And a lot of times in my career, I've been really lucky. I've had bosses like Peter Homer, like David Fillingham, who've given me the space and the opportunity and support. But I haven't always had that. And I see that a lot in other people who lead on quality improvement, that they haven't necessarily got it either. And I'd say what you have to do is make your links. You have to connect up with other people with the same passion and the same mission. And if you get a line manager who gets it, that's fantastic. But don't count on it. You absolutely can't do this on your own. And I was kind of delighted that that we're talking to some of the people who I consider to be the kind of giants that the rest of us are on the shoulders of. So when I think about people like Peter Wilcox, I think about people like John Oldham. They were the real pioneers. So getting the opportunity to learn from, to connect with them and the people that came afterwards, I think that's what makes the biggest difference. A factor that helps me to be resilient is I have one foot in the present and I have one foot in the future. So when things aren't necessarily going the way that I want them to day day in the role that I do, then I can escape to the future world that I live in, which is very often now, it's a world that's based on social media, and it's about connecting up with people all over the world who are thinkers and practitioners and futurists, and are seeking to create a different future. And these are people that I can connect with intellectually, and also connect with emotionally, because many of these people have the same values and aspirations and ambitions that I have. And actually being part of that connected social media world is really important to me and helps me to stay sane and strong, often in difficult circumstances. So I actually think that I was probably born 20 years too early, because just the whole way that things are going, actually, social media and digital connectivity actually came very late to me in my career. And yeah, maybe I wish it had come a little bit earlier.
So as one of the pioneers of early work and improvement in the NHS, what would be your key advice to people taking up the leadership mantle for improvement now?
I'd say that quality improvement is more like a social movement than it is a programmatic response. So I'd say, of course it's about data and measurement and good method. But it's even more about making a connection with emotions and values and the reasons, why we do this. And, learning the skills and from the experience of the great social movement leaders, who didn't have resources in a formal sense, who didn't have positional authority or power, and yet were able to do things to change the world. What did those leaders do? So I guess in that context, one of the things I'd say is don't just learn your quality improvement toolkit, Don't just be somebody that gets trained in the methodology, okay, of quality improvement and improvement science. Take that and add other methods and approaches. So whether it's community organising and social movement thinking, whether it's organisational development, whether it's human-centred design. Actually, I think that the best quality improvers bring a very rich variety of perspectives and methods. And a final thing I'd probably say is about go for diversity. And I think that one of the things that I've learned over the years is the importance of working with diversity. People challenging and questioning and being divergent is a real gift, because our reality is that diversity and dissent and divergence, okay, makes us look at the world much more broadly. Having many different voices means that we'll get better change and we'll get better outcomes. So some advice I would give to my younger self is about using the resources that are there in the system. And again, when I look back over maybe the last 30 years, there's often a tension between what you can do from the inside and the ideas you need to bring from the outside. And I've been really lucky because I've been able to work with some phenomenal people. But very often what we've done is that we've brought external experts in. And when experts come in, and often I've been the key person that's commissioned experts. What I end up doing is like subordinating myself to the outside expert, and it's crazy because I've been doing this for years. But you're paying for an expert, so you bring them in and you kind of let them do things. You let them do things their way. So I'd probably just think about getting the relationship right, because external help's really important. And that history tells us that, that the best ideas come from outside. So I'd work harder at getting the relationship right between inside and outside. So let's work with the strength of the current system, and let's find ways of connecting people up, because an awful lot of the expertise is in our system already. And let's find the proper place for external advice and support without subordinating ourselves to it. One thing that I've learned being in improvement for a very long time is that there are ebbs and flows. And sometimes improvement leaders are in the ascendancy and sometimes they aren't. And that's just the reality that you have to get used to. And the other thing that happens is the world around us is moving in very quick cycles. It's moving in management career cycles, it's moving in ministerial, electoral cycles, and things change. And you know, for people like me, it can be incredibly frustrating because you're moving forward all the time, you're creating, you know, new learning, you're creating breakthroughs. But very often you have to go a step back before you can go 2 steps forward, because the people that you're working with, you know, they haven't learnt the same things that you learn about scaling and spreading change. You know, they haven't learnt the same things that you have around engaging people and getting them on board for large-scale change. So very often you're going backwards before you can go forward. So yeah, you need a lot of patience, and I think you need a lot of perspective. You know, quality improvement is a long-term game.